Your doctor just told you that managing your health conditions will get harder as you age. But what if I told you that's only half the story? What if the real secret to thriving after 60 isn't about fighting your conditions, but working with your body in ways most people never discover? I'm going to share something that could change everything you thought you knew about managing diabetes, arthritis, and heart disease. This isn't about miracle cures or expensive treatments. This is about understanding what actually works when you're over 60. Here's the truth. Your body after 60 operates differently than it did at 40 or 50. The strategies that worked before might actually be working against you now. And that's exactly what we're going to fix today. Let's start with diabetes management after 60. The conventional wisdom says to strictly control your blood sugar at all times. But recent research shows something surprising. Older adults who maintain slightly higher blood sugar levels, around 120 to 140, often have better outcomes than those who aim for the standard 100. Why does this happen? Your body's ability to recover from low blood sugar episodes decreases with age. A severe hypoglycemic event can be more dangerous than moderately elevated sugar levels. Your brain needs consistent glucose, and extreme fluctuations become riskier as you age. The key is consistency, not perfection. Instead of obsessing over every reading, focus on keeping your levels within a comfortable range. Work with your doctor to adjust your target numbers based on your overall health, not just textbook standards. Now let's talk about medication timing. Most people take their diabetes medications whenever it's convenient. But timing matters more than you think. Taking metformin with your largest meal reduces side effects and improves effectiveness. If you're on insulin, coordinating it with your activity level makes a huge difference. Here's something most doctors won't tell you. Your medication needs will change as you age. What worked at 62 might be too much at 68. Regular reviews every 6 months, not just yearly checkups, can prevent complications and reduce unnecessary medications. Moving on to arthritis management. The biggest mistake people make is thinking less movement means less pain. The opposite is actually true. Your joints need movement to stay lubricated and healthy. But here's the catch. The type of movement matters enormously. High-impact exercises that worked in your 40s can damage already compromised joints. Swimming, water aerobics, and Tai Chi provide movement without stress. Even 15 minutes of gentle movement 3 times a day beats one long workout session. Your joints respond better to frequent, gentle stimulation. Pain medication is another area where people get it wrong. Taking pills only when pain becomes unbearable means you're always playing catch-up. A consistent, low-dose approach often works better than sporadic high doses. This keeps inflammation under control before it spirals. But here's what really makes a difference. Weight management impacts arthritis more than any medication. Every pound of body weight puts 4 pounds of pressure on your knees. Losing just 10 pounds can feel like removing 40 pounds of pressure from your joints. Nutrition plays a massive role too. Anti-inflammatory foods like fatty fish, olive oil, and colorful vegetables actually reduce joint pain. Meanwhile, processed foods, excess sugar, and certain oils increase inflammation. Your diet is either helping or hurting your arthritis every single day. Now let's address heart disease, which requires a completely different mindset after 60. Your heart has been beating for over 2 billion times by this age. It needs support, not stress. The goal shifts from performance to preservation. Exercise remains crucial, but intensity matters less than consistency. A 30-minute walk 6 days a week protects your heart better than intense workouts twice a week. Your heart benefits more from steady, regular activity than occasional bursts of effort. Stress management becomes absolutely critical for heart health after 60. Chronic stress raises cortisol, which increases blood pressure and inflammation. Finding daily practices that calm your nervous system, whether meditation, gardening, or music, directly protects your heart. Sleep quality affects heart health more than most people realize. Poor sleep increases heart disease risk by 45%. If you're not getting 7 to 8 hours of quality sleep, everything else you do matters less. Address sleep issues with the same urgency as medication compliance. Medication adherence for heart conditions is non-negotiable. Missing doses of blood pressure or cholesterol medications creates dangerous fluctuations. Set up systems like pill organizers, phone reminders, or pairing medication with daily routines to ensure consistency. Here's something that ties all three conditions together. Chronic inflammation is the common enemy. Diabetes, arthritis, and heart disease all worsen with inflammation. Controlling inflammation through diet, stress management, and adequate sleep helps all three conditions simultaneously. Hydration is another overlooked factor. Dehydration thickens your blood, raises blood sugar, and stiffens joints. Most people over 60 don't drink enough water because thirst signals decrease with age. Aim for 8 glasses daily, even when you don't feel thirsty. Social connection impacts all three conditions in surprising ways. Loneliness and isolation increase inflammation, raise blood sugar, and stress your heart. Regular social interaction, whether family, friends, or community groups, provides measurable health benefits. Now let's talk about the medical team approach. Managing multiple conditions requires coordination between specialists. Your cardiologist, endocrinologist, and rheumatologist need to communicate. You become the coordinator, ensuring everyone knows what medications and treatments you're receiving. Keep a master list of all medications, supplements, and treatments. Bring this to every appointment. Drug interactions become more dangerous as you age and take multiple medications. Your pharmacist can be an invaluable resource for catching potential problems. Regular monitoring becomes essential. Blood work every 3 to 6 months catches problems early. Don't wait for symptoms to appear. Diabetes complications, heart issues, and arthritis progression can advance silently. Early detection means easier management. Here's a practical tip that makes everything easier. Create a daily health routine that addresses all three conditions. Morning stretches help arthritis. A balanced breakfast stabilizes blood sugar. A daily walk supports your heart. Bundle these activities into one consistent routine. Supplements can help, but they're not magic bullets. Omega-3 fatty acids support heart health and reduce joint inflammation. Vitamin D helps with bone health and immune function. But always discuss supplements with your doctor, as they can interact with medications. Diet deserves special attention because it affects all three conditions. The Mediterranean diet consistently shows benefits for diabetes, arthritis, and heart disease. Focus on whole foods, healthy fats, lean proteins, and abundant vegetables. Limit processed foods, excess sugar, and unhealthy fats. Meal timing matters too. Eating at consistent times helps regulate blood sugar. Not eating too late improves sleep quality. Starting your day with protein and healthy fats provides stable energy and reduces inflammation. Here's something crucial about setbacks. They will happen. You'll have days when blood sugar spikes, joints ache, or you feel short of breath. Don't let temporary setbacks derail your entire approach. One bad day doesn't erase weeks of good management. The mental aspect of managing chronic conditions is huge. Depression and anxiety are common when dealing with multiple health issues. These mental health challenges make physical conditions harder to manage. Addressing mental health is just as important as taking your medications. Finally, let's talk about quality of life. The goal isn't just to manage numbers on a lab report. It's to maintain independence, enjoy activities you love, and spend time with people who matter. Every health decision should consider how it affects your overall quality of life. Managing diabetes, arthritis, and heart disease after 60 is absolutely possible. It requires consistency, not perfection. It demands attention, but not obsession. And it works best when you view these conditions not as enemies to fight, but as aspects of your health that need ongoing care and attention. Your body after 60 can still do amazing things. With the right approach, you can manage these conditions while maintaining an active, fulfilling life. The key is working with your body's current capabilities, not against them. Start with one small change today, and build from there. Your future self will thank you.